Hi, everybody. Happy Tuesday. My name is Natasha, and I am a naturopath on the team here at the Lucy Rose Clinic. Feels like it has been a very long time since I've popped onto our lives to have a chat to you about our topic of the week. So I'm so happy to be back and chatting to everybody. I hope that everybody has had an amazing Christmas and a really nice and restful New Year's break. I personally have, and it has made me feel nice and rested and excited to come back and hit the new year running. So, we have an interesting topic today. The topic is all about reaching your health goals for 2025. Now, in order to have health goals, we need to know where we are struggling, what we are suffering with, areas that we would like to see improve in general. So, we also want to dive in today on how testing can be a tool to help us reach those health goals and also create a bit of a measurable of improvement. So, the most important thing about having a goal or having a health goal is knowing when you have achieved it. What will that look like for you? What will that feel like for you? And how can we actually measure it to make sure that it is a markable goal that we've achieved or an improvement that we have made? So, what we'll go through today is trying to simplify what your health goals can be. I'm going to make that a fun and creative exercise for you. And then I'm going to elaborate on how we can use testing, which is what we absolutely focus on in the clinic here, to create a measurable. What can we test for? What is relevant to be testing for based on your symptoms? And how can we get that going for you as soon as possible so that we can help you on your road to achieving those health goals? So, I guess when we talk about goals for the year, everybody does get very excited about making sure they are setting an ideal for a goal, what they would like to achieve. Sometimes we can get a bit distracted in the follow through. So, also want to chat about how you can help keep yourself accountable in that manner in achieving your goals as well. A health goal. It is something that should be measurable. It should be seeing something that we can feel, something that we can see as an improvement, and it should be realistic. We don't want to set any unrealistic expectations for ourselves so that in efforts to achieve it, we're not going to also feel like we've let ourselves down if we haven't gotten there. I'm going to give an example of some key health goals. It can be physiological, it can be psychological, and it can be emotional, or maybe a mix of a few. Very common ones that I'm hearing very frequently: I'd like to lose weight, I would like to have more energy, I would like to sleep better, I would like to get into the gym and start exercising. These are some common ones that we do here. Now, for each of these, there is something behind them that is a preventative barrier for you achieving. Let's start with weight. Now, if weight is something that you would say is a health goal, what is the reasons behind weight? What is the reasons between why you can't gain? So if it's a goal to gain or gain muscle, get healthier, get stronger, or what are the reasons behind not being able to lose weight? This is the golden question. So that is why testing is the most critical for this particular goal. Yes, we can absolutely use our common interests of dietary changes, exercise recommendations. We do need to make sure these two things are priority points in addressing any weight concerns. However, most patients here at the clinic, have been dieting and they have been doing exercise, and this has not helped them lose weight. So this is why we further explore things like your thyroid health. So your thyroid is something that controls the speed of your metabolism, which absolutely controls your weight. Cortisol. So cortisol is something that everybody experiences an imbalance with at some point in time, because it is our motivational hormone, it is our fight or flight hormone. So we do need to address that cortisol fluctuations occur. And in times of stress, this can also contribute to weight gain, particularly around the stomach. Blood sugar issues. So insulin, glucose, these can be an issue in terms of trying to lose weight. And things like sex hormones as well. So we know during transitions of perimenopause and menopause, estrogen particularly can actually play a role in weight gain too. So let's use this example as a amazing validation point for looking at functional testing. The testing is going to give us the answers as to why you can't lose weight or shift weight. And this is going to enable us to treat so much more specifically. If we get to the bottom of if you have a thyroid issue, if you have a blood glucose issue or insulin resistance issue, then we are able to see, is this the reason why you are not able to lose weight? Making a very personalized treatment for you, then your health goal becomes that much more realistic. It becomes so much more in the near focus of achievement because we know exactly the steps we need to take to get there. So that's a very good example of something that is a health goal but requires some background work in order to get there. Now, if we're thinking about things like energy, identifying that yes, I want to have more energy on a day-to-day basis in 2025. Again, why do we need to explore testing? Because it's going to give us the reasons as to why you do have low energy. We can get things like your sleep right. We can get things like your diet right, which is what we will work with you one on one in. But if we're missing things like iron deficiency, if we're missing nutrient deficiencies like B12, if you have low cortisol, these can all influence very severe fatigue, and they are essential for us to explore through testing to make sure that we are getting to the bottom of what's causing fatigue. Now, I could go on. I could explain if you have poor sleep, then we need to address sleep hygiene, behavior, and also maybe test your melatonin. It is absolutely applicable to do the groundwork and look at identifying what levels of testing we need to do in efforts to get you the answers to achieving your health goals. In terms of finding the answers, that's what we're here to do to help you. So, if you have been to the GP, talked about these symptoms that you might be experiencing, and not had the best answers or explanations for why you are feeling the symptoms, and perhaps you've been told everything is normal, perhaps you have been told, let's wait and see if it changes, try changing your diet, try changing your exercise, try losing weight. These, unfortunately, I am hearing all the time, but they're not painting a very clear picture of how you can actually get to that next step of achieving the health that you would like to see. That's what we do here. We are doing the groundwork and identifying where these issues are in your life to prevent you from being the absolute best you can be. So that's amazing things about saliva, about urine, about blood testing at the clinic here is that it will give you the answers. Now, in implementing tools for staying on track with achieving these health goals, we will work with you to identify what is that going to look like when you have achieved the goal. Okay, so you say that you would like to have more energy in 2025. What does that look like for you? Is it going to look like waking up and bouncing out of bed and not snoozing the alarm? Is it going to look like getting to 3 to 4 p.m. and actually doing an exercise class or going for a walk instead of taking a nap? These are essential because they're going to help us create a measurable or a tick box criteria that you have actually reached that goal. And it is realistic to get there. I have seen it many times for patients who have absolutely gone down our path of support and in as little as 4 weeks have been able to see an improvement in these symptoms. It's just taking that first step. So, this needs to be something that we do regular check ins on. That's why it is important to work with someone in achieving your health goals. If you know that you are wanting to embrace a new level of health, but you're not sure how to get there and you're not sure what to do, this is when someone like our naturopaths on the team here are here to help you with that as well. Accountability. The most amazing thing you can do for yourself is set aside some time every day to remain accountable. I love journaling. I think journaling is a fantastic tool. It doesn't need to be a long process, it doesn't need to be complicated. It does need to be something that you are reflecting on to say, what did I achieve today? Is there any markable improvement that I have gone about my day, but not noticed until this moment when I've actually reflected. A lot of the time, when I am working with a patient who may have these common examples of health goals, energy, sleep, weight loss, it isn't until we're actually going through a reflection and saying, how is your energy throughout the day? Have you continued to stay up the whole day without needing a nap? How is your sleep? Did you sleep through the night and not wake up once? How is your weight? Have you actually made some losses? Have you changed into a different size of clothing? Have you felt less inflammation or fluid retention? Sometimes these are unnoticed because they are just general improvements that you should be feeling on a day to day, which is a fantastic point of reflection for myself when I'm having these conversations with patients. It is showing us that you are achieving these health goals that you set out to pursue in the new year. And it's a fantastic time of the year to embrace what these health goals may be. So, in reflection, we absolutely have a baseline of testing that we would recommend in efforts for you to achieve those health goals you would like to achieve. It is going to paint the pathway of exactly how you need to get there, what you need to be doing, what dietary changes we need to be making, what supplements you may need to be on, what types of lifestyle changes you may need to make. It can allow us to specifically say, yes, this testing shows that you have an insulin resistance issue. It is really important, as an example, to be doing a mix of strength training and cardiovascular training because this is what helps to improve insulin resistance in patients. In implementing those changes, the rest is up to you. Attending that group class, going for that walk, changing that dietary behavior, choosing something different when you go to the shopping center for your groceries, and making those changes is what's going to ultimately get you that one step closer to achieving that health goal. Are here to keep you accountable. We are here to help you find the answers as to what you need to do first in efforts to get to your health goals. And we're even here to help you identify what these health goals may be. You may not need to know what you would like as a health goal right now. We can help you with that. It is our absolute pleasure to help people identify how they would like to improve their health, especially in this new year. Let's make 2025 one of the best years for your health improvement and allow us to help you get there. If you would like to know more, if you'd like to have ask some questions about achieving your health and how you can improve yours, then please book in for our free 15-minute discovery call. You can access it through the QR code on this video, just up in the top right-hand corner. And you can also head to the Lucy Rose Clinic website and book in for that free call. We look forward to chatting to you. I hope this has been helpful in breaking down the steps needed to help you get there to your health goals. And I look forward to chatting to you all very soon. Enjoy the rest of your evening, and I look forward to chatting to you all next week.